On behalf of ASN members and staff, thank you for choosing ASN as your trusted source for important information related to infection prevention and control in the outpatient dialysis facility. The included Candida auris frequently asked questions will share facts based on known information at the time of publication. We hope you will find this information helpful when caring for patients with known Candida auris infection or colonization while being treated in an outpatient dialysis facility. Let's start by introducing important operational and clinical best practices. These are practical interventions based on the experiences of dialysis facilities caring for patients with Candida auris. Clinical leaders should coordinate with the operations team, the medical director, and the infection prevention clinicians to ensure the facility has implemented admission and communication procedures to include questions regarding Candida auris infection status and other aspects important to the care of the patient. Establish good communication among clinicians and operations and ensure the facility is adhering to all regulatory guidance. Prepare for the admission of a patient with Candida auris by ensuring the facility has a plan for minimizing the exposure to unaffected patients to include ensuring there are adequate levels of personal protective equipment. Ensure the facility has approved disinfection products and that necessary medical equipment are available. In addition, leadership should provide and continually reinforce staff education regarding safe practices of caring for patients with Candida auris. It is also important to offer patient education regarding infection prevention practices. Ensuring physical separation is an important consideration when caring for a patient with Candida auris. Options for physical separation are elaborated in frequently asked questions section found below. It is important to determine if it is appropriate to use an end or corner station versus using an isolation room. For example, if an isolation room is available and there are no hepatitis positive B patients receiving treatments in the facility at any time, you may consider using the isolation room as long as the appropriate terminal cleaning has been done. If the facility chooses to use the isolation room, it is important to maintain strict adherence to the facility's policies regarding the use of the isolation room and a plan for responding to a hepatitis B positive admission request when the room is being used by a hepatitis B negative patient. When using an end or corner station, you may consider scheduling the patient at the end of the day to increase the time between patients and allow for thorough disinfection. Consider leaving an empty chair next to the patient. It is important to remember the risk to other patients can be staph transmission inadvertently from cross-contamination. Even the best practices may be broken when not reinforced. Continued education is important and should include, but not be limited to, observing environmental cleaning and disinfection practices, including dialysis equipment and frequently touched surfaces, donning and doffing of PPE, disposing of gowns and gloves, and hand hygiene. Leadership may consider utilizing CDC audit tools and checklists for dialysis settings to monitor IPC practices and identify gaps and opportunities for improvement. For more information regarding Candida auris, please review the frequently asked questions below.